Okay, well, good afternoon, everyone, and thank you for joining us for this panel. And of course, welcome and thank you, the panelists today. And as you can see, we are going to be discussing a new initiative that Pitt and several technology companies, particularly Vizzhy and others, have joined to create. And we're calling this GAINMED. Essentially, it's a short form for generative AI navigated medicine. So the concept is that there is a large data out there that will continue to grow in size, whether it's omics data or biomedical data, research data, or patient-derived clinical data. All of this is continuing to evolve and become larger and larger, providing an amazing source of information, but also creating a massive challenge to understand and develop appropriate diagnostics, decision support, clinical tools, as well as clinical solutions. So the concept of GAINMED is to really build that future vision and begin to start that work here in Pittsburgh. So it's wonderful to have the panelists who are participating in their own way in creating this. But let me start with Dr. Vishnu. Dr. Vishnu Vardhan is the CEO and founder of Vizzhy Inc., which is the AI platform that is building GAINMED. So Vishnu, you want to say a little bit about yourself?
Yeah. Thank you, Dr. Shekhar, for calling me and for this wonderful association with University of Pittsburgh, which has been going on since last 2 years. So a bit of background about myself. I started as a orthopedic and trauma surgeon. So I have worked in a lot of big hospital networks in India, led few of them, and I also worked as a director of trauma services in United Nations. But what interested me always was digital transformation of healthcare. So that took me to MIT. So that's where my digital transformation journey began. And since last 6 years, I've been working on digital transformation of the healthcare. And all this has led to something called an amazing transformation, which we are going to bring in GAINMED, which I will be talking about later in this panel. We're very excited to talk because we are going far ahead than any other company or platform in the world. So I will start with that.
Thank you. Thank you. Our other panelist is Dr. Yasutaka Ikeda. Dr. Ikeda is the Director of Advanced Research Institute for the Core Biosciences for Otsuka Pharmaceutical in Japan. And they have some wonderful, exciting new innovations that they're looking at for anti-aging, but also using multi-omics to develop novel approaches. So you want to say a little bit about yourself, Dr. Ikeda? He has a translator who is speaking to him in Japanese, but Dr. Ikeda himself will speak to us directly.
Yeah.
Please,
yeah.
Go ahead.
Thank you for introducing me. First, I'm not very fluent in English, but I hear everyone is fluent for me. So please hear what I'm saying. Your warm heart, please. I'm Japanese, and I work in Otsuka Pharmaceuticals, and I'm director of Advanced Research Institute for Core Science. I have been conducting the research of longevity and aging, and I have now innovative product, I think so, and collaborative research with Akshi and other people. And I think my product change the world and have a good health world I can create. I think so.
Yeah.
Thank you.
Yeah, we hope so. Certainly, we all need it as we age. And so I also want to thank Ari, who is the translator here, who is working with him. And then the final panelist here is Afshin Beheshti. Dr. Beheshti is a professor of surgery and computational and systems biology, and he's also the director of our Center for Space Biomedicine. And he has been working very closely with Dr. Ikeda in various, I would say, futuristic synthetic biology and various types of mitochondrial technology using AI. So you want to say a little bit about yourself?
Sure, yeah, thanks for having me part of the panel. Yeah, as I said, I joined here last September 2024, and before that I was at NASA Ames Research Center. I do a lot of different types of work, and mitochondria is one of them, and plug and play, and using multi-omics and AI with Dr. Vizzhy is one of the things, we'd like to push things forward with, because we really think that's the way of accelerating things in the future. And with Yasutuka and Atsuka, there's a lot of promising things. We're looking at mitochondrial related supplements that really be able to push things forward. But again, we use multi-omics and AI to really push that forward with some other colleagues in the audience too. So there's a lot of exciting things to happen.
That's great. Well, let me start with Vishnu. Tell us a little bit about why GAINMED and why Pittsburgh. How did this happen, and how do you think this is a perfect place for doing this?
Yeah. I will come to the Pittsburgh later because it's all related to the first part of the answer which I want to give. So this entire journey began with my mom. So she had diabetes, and we have a very bad family history of diabetes. I was like, what is the best as a doctor I can give to my mother? Can we reverse diabetes? Can we cure it? Or else we have to keep taking the medicine. This was my thought 5 years back when she was diagnosed as a diabetic person. And wherever you go, of course, they will say that you have to take medications and then keep continuing to control your sugar. So this led me to think that why are we even limiting ourselves in just managing the sugar? Why can't we stop this, reverse this? That's what took me into this entirely amazing field of multi-omics, to understand that what happens in diabetics, why exactly does this happen, what are the things which are looking at. And to my surprise, I found that we are just playing with few hundreds of biomarkers, the entire healthcare, clinical care, and there are like 3.2 billion data points in the body which we don't even look at it. So a lot of researchers are there. In Pittsburgh, amazing research is going on virtually all the omics, but that doesn't really translate into healthcare, right? So everywhere there are like top geneticists working on each omics. So we said, can we really bring this to clinical translation, where we can use it on real people to, reverse their diseases, stop it, do all this P5. So that's when I was looking at a place where I can bring this kind of research and also, clinical capabilities. That's when I met Dr. Shekhar, and all this led to the GAINMED here. So today we are very proud to announce that we have built the world's first multi-omics lab where I can sequence 3.2 billion data points of a human and then map the entire thing out on a biological map and tell exactly what are the biological pathways which are affected. Not just the disease, but what's going to come, what's come, and what can be the complication. So to understand that, we needed AI. So we didn't go searching like, okay, there is an AI, there is a chat GPT, so let us use it for healthcare. We said, this is so much of complexity. How can we make it simple that anyone can understand and use it? That's where we use our generative AI navigated multi-omics medicine, because all these are very complex things for a clinician or a patient to understand. So that's when we brought in our AI, which makes it very simple for anyone to use it. Because what so to put the entire thing into perspective, when you look at finance, when you look at stocks, when you look at education, everywhere you have your own knowledge, you manage your things. Only healthcare is outsourced to healthcare organizations. as a person, you don't manage your biology. Is it right or wrong? Every one of us have outsourced our biology to a healthcare institute or a hospital or a doctor. We don't manage our biology. The aim of GAINMED is to bring back the control of your biology to you so that you manage your health. Doctors will come when they need to, but you don't need to outsource your biology to them. So that's where we use our AI, because the intent is to make it very simple that today, cut short, the first story I told about my mom, she's reversed her diabetes. Since 5 years, she doesn't have diabetes. Forget about diabetes, she doesn't even have insulin resistance, which is a very premature form of diabetes. And she's managing that since last 5 years. She's 67-year-old who hardly understands English. If she can do that, I feel anybody on earth can really do it if you can give that kind of information back to them. So that's where all the projects, all the GAINMED platform is geared at, and we are launching some very big programs in diabetes management, in heart care management, and in cancer, understanding cancer here. And also working with, this is an amazing thing which I want to again talk about, the collaboration we are doing with Otsuka, because here I feel this is the pharmaceutical company which is going to use the entire multi-omics platform to understand how these drugs or nutraceuticals work on the patient, on the person. So we are, it might be one of the first trial where we can really nail out like how the biology itself reacts to a new drug, because this works on mitochondria. So we are studying the mitochondria and how it affects your oxidation and the energy uptake. So this is an amazing collaboration where we are going deep into understanding how the drug itself works on your mitochondria. So this is amazing because of the fact that this kind of thing is not happening anywhere in the world, where entirely the healthcare is transformed by two basic technologies of multi-omics and AI, built exclusively for understanding the biology. Here the AI is understanding biology rather than the language. So this is something which has been built exclusively for healthcare, and it's happening in Pittsburgh because Pittsburgh comes with its amazing infrastructure where it has a world-class research institute, a very large healthcare system, and most importantly, the intention to really work for the healthcare transformation rather than, the commercial aspect of it. So that's what brought me from Boston to here. If you ask me why Pittsburgh, the major reason is healthcare transformation. When I proposed this, 5 years back, this looked like totally a moonshot, which is not possible. But Pittsburgh is really proving that even a moonshot is possible and we can do it. Thank you, really. I have to thank the entire ecosystem here, especially Dr. Shekhar, who first listened to my vision and then brought the entire thing here. But the entire Pittsburgh has really put in a lot of support to enable this. And that's why we feel that Pittsburgh is going to be Framingham 2.0 for new transformation of the healthcare, because this is where the real transformation of personal healthcare is going to start.
Well, thank you. That's very exciting vision. So moving on to what you brought up there about pharmaceutical industry and how our new areas of drug discovery, drug development, and understanding disease and treatments will be based on multi-omics. So I would like to see how Otsuka began to think of this as their primary strategy, especially given that your focus is on aging, longevity, and probably the most pressing problem for Japanese population. Yeah.
I think I have answer. I don't have an answer. I focused on mitochondrial function. My research is found that the low oxygen condition within our body, that it indicated that mitochondrial function is not lost, but mitochondria are placed where they cannot perform.
Yeah.
So I think aging is that simulation situation.
Yeah.
So I now conducted the experiment of mitochondria.
Yeah.
So
On aging.
Yeah.
Yeah. So maybe Afshin, you can add to this. Obviously, aging and space are constantly related, and of course, functions of various parts of the cell change when you're in space. So how did you get connected with Otsuka and the whole project of mitochondria?
Yeah, so I mean, one thing I think that caught their attention, going back to your original question, this question is tied together, is that, I do a lot of mitochondrial research, and space is an accelerated model for aging and a lot of diseases, and of course mitochondria, well, not of course, but for me it's of course when you become a mitochondriac, but maybe not for non-mitochondriacs, I don't know. But everyone should turn into mitochondriac after this. So, what happened was we put out a huge multi-omics paper 5 years ago about how in multi-omics you could do an unbiased analysis, going in basically with a clean slate and not targeted. And this is the power of multi-omics and then using AI, as Vishnu talked about doing this. So then when you do that, then the data tells you what's important and not what your bias would tell you what's important. So then this is what happened. We had a large collaborative network of people we work with, which is I think a way model forward too, because multi-omics is a big data, AI is big data, you need more people to work with you. So the key was then, what happened was, everyone went into their various expertise, analyzed all this massive data we had related with spaceflight damage and things like that. And indeed, the top hit and everything that came back was mitochondria. Whether it was astronaut data we had, where they had mice sent to space and other things, cell cultures and simile experiments, mitochondria was a top hit. Everything downstream of that with immune dysfunction, cholesterol-related issues, lipid accumulation, mitochondria was centrally dysregulated in space due to the space radiation and the microgravity there. So then that's how Otsuka, Yasutuka saw this paper because he was, as you've heard, in the mitochondrial interest, and they're working on this very beautiful supplement that's being to restore that. And he said, how do we get this in astronauts? I said, well, let's do the studies first, and then let's do this multi-omics study, an unbiased approach to figure out the mechanism and things that happen. So we did the study, and indeed, it's been showing that with the collaborator Chris Mason out in the audience, and Jonathan Schisler, who's somewhere here in UNC, that we were able to show that indeed, we were able to mitigate the damage caused by this, and the multi-omics approach is showing us how mitochondrial function is restored, and downstream of that, maybe inflammation and immune function, and everything tied to aging, because space accelerated aging, how this might be a preventative. And then downstream of that now, anything you do in space comes back to the clinic. It just doesn't affect the few percent of people, because space is an accelerated model for aging. Although the mechanism done is different from radiation, the health effects and the downstream consequence mechanism happens to be the same. So then, we looked at, he said, well, let's do a clinical trial now, what we're doing, and Dr. Vizzhy is involved with this too, to see how mitochondria might improve daily health. So now we're doing this nice clinical trial with, well, we're going to start it, we haven't started yet, but we're going to do the patients.
This is a clinical trial at Pitt.
At Pitt, we're doing the clinical trial at Pitt, which that's why he's here. So then we're going to use the multi-omics Pitt Vizzhy lab to do this and use the AI tools, and then we're going to figure out, indeed, if you take the supplement that is there, can everyone become younger? 20 years younger. We can see Dr. Shaker take it, and he'll be here for another 100 years after he takes this.
I'm not sure my faculty would appreciate that, but
well, like it.
but I think that's great. So the drug that you are working on, that you're going to be doing a trial and measuring multi-omics repeatedly on these subjects to see what anti-aging effect it has. How did that design come about, and what made all of that come together because of GAINMED and the Vizzhy labs?
Yeah, so I mean the reason was first from the space data we had from the previous experiments, but then how it came about because we had the facilities because of it just Vishnu said it being set up. Nowhere else in the world has that, so that's beautiful. And then to get the actual data to figure out what are the key mechanisms to create this, the metabolomics, the proteomics, everything else. If you don't know where else can do this, as well as what Vishnu is setting up here with Pitt and everyone. So seeing that and the GAINMED AI tool that's there, I mean that's a powerful technique to use the patient records, the previous history, because no, usually when people get multi-omics data, they just analyze it, figure out, let's say, okay, these key hits happen. But incorporating the AI tool of Vishnu's, and the GAINMED of Pitt and Vishnu's, that's a key to be able to integrate truly with how the patient can be improved in life. Whether it's a poor responder to this supplement or a good responder, and why there's poor responders and bad responders, this is what the AI tool comes in, that you can't just do naturally.
Right. So what is the ultimate goal of this mitochondrial enhancer that you're testing?
Yeah, so ultimately they're going to have a supplement made. So it's a supplement, so it doesn't need FDA approval, but they've done all the tests to make sure it's safe in human. But ultimately it's a supplement they make available to the public, that people can take as a mitochondrial antioxidant naturally if they want. Or maybe potentially, like, for example, the same mechanism that happens in space to cause the downstream effects of mitochondria, we see the same kind of thing happening in long COVID patients. And there's 400 million people suffering long COVID around the world. There's no therapeutic for them. So maybe this is a potential therapy for long COVID patients. This would be a next trial we could do, because this comes out, we know that mechanisms might increase in rescue, but now this might be a clinical trial eventually we could do to help all the 400 million people with long COVID that unfortunately don't have that. Yeah.
No, that's great. But it's a great illustration of AI, multi-omics, understanding biology, and coming up with a solution that is completely out of space, I guess. No pun intended, but literally coming from space. That's wonderful story. Vishnu, question for you is, like, obviously these type of activities require massive amounts of data, curation, data collection, curation, storage, and cybersecurity, etc. How are you planning about that for GAINMED and, for a variety of these types of projects?
Yeah, it's a great question, because we have to, just like we had to put the entire infrastructure for doing multi-omics, which is establishing the wet lab. So to do this entire work, so one multi-omics data set really throws up about 250 GB data, and this has to be analyzed and crunched in real time to make sense of it. And imagine doing it for 1 million people. It's going to be one of the massive infrastructures ever created in healthcare in the world. So we are working with Microsoft on this. They have something called Azure Confidential Compute, which comes with world-class encryption and data security, because this is very sacrosanct data. We know we are handling much larger than just the genomics data of a person. So we are like kind of imagining a different type of security systems, because we feel this is going to be the most valued secure, data ever created. So this Azure Confidential Compute, and most importantly, we need a lot of GPUs, the latest NVIDIA chips and the AMD chips which are there, because this humongous data will take weeks if we use the normal computing to analyze. So using GPUs have really brought down the time level also. We might do something like next year where we will be sequencing the entire whole genome sequencing in 4 hours and releasing a report which can be a world record. So we're attempting that. Wait for us to announce that next year in 2026. Imagine that 120 GB of data is collected for whole genome sequencing, analyzing and releasing a report in 4 hours is going to be something which will be like headlining next year. That's the plan.
Well, great. That's a great vision. In terms of, just these types of work that we do, and at the same time, costs keep going up, right? I mean, all of these infrastructure, et cetera. How do you see AI and GAINMED actually bringing the cost of healthcare down rather than add more layers to it? Any of you?
Yeah. No, that's the meat of it. That's the most important question, because when you look at it, it looks very expensive. But when you look at the entire, like somebody who is a diabetic will end up consuming hundreds of thousands of dollars in their lifetime. So if you reverse diabetes and you don't take medicine for next 5 years, imagine the kind of cost that we are saving for the healthcare. We feel that healthcare costs are going up because we are going on medicating people for various diseases. Like the GLPs have really thrown a cat in the whole hand. Like it's become $100 billion expense out of nowhere, and it's not a sustainable solution, something which has to be taken at such expense. So this approach of understanding the real biology of the person and trying to prevent and reverse it is going to save trillions of dollars of healthcare costs. Healthcare is the biggest cost for the entire globe. It's $9 trillion, and it's like $4.5 trillion for US. So it's super expensive to just keep medicating people than really understanding their biology. And whatever we are talking were very expensive in the beginning. When I did my first multi-omics, it costed me tens of thousands of dollars. Today we can do it at perhaps 1/50th the cost. And with massive infrastructure like this coming up, we feel that it's going to be very affordable for anyone. And most importantly, the twins which I'm talking on the AI, they will be costing something like $100 per year to just manage. So it's going to be very cost effective. It will save a lot of cost. The entire transformation was that, like, how do we save the cost of healthcare rather than add more cost by bringing more technology? That's there. So a lot of technologies come and add to the cost. But our vision was, how do we bring down the healthcare cost? So this is the approach.
That's great. That's great. So Dr. Ikeda, you've seen the infrastructure we have here at Pitt and the multi-omics labs and various technologies. How do you feel about now becoming a core partner with Otsuka and Pitt and doing all of your multi-omics work here? As opposed to, I'm sure there are many Japanese labs that would want to do that with you.
Yeah, yesterday I visited your lab, and I'm surprised at the massive and environment research environment. Yeah. So I'm exciting with you collaborating research. So I have ever visited around the several universities of US. Pittsburgh University's institute is very great, and I'm surprised. And so I want to conduct the collaborative research with you.
Yeah, I want to just emphasize, he just said that he has visited a lot of universities and he was so impressed with Pittsburgh, he wanted to be our partner. So we're very thankful, and of course we're excited to partner with you.
I love action. So I want to collaborate with him and Pittsburgh University.
You mean he's the attraction, not Pitt?
No.
Yeah. Okay.
Yeah.
All right. Well, that's great. So, Afshin, what do you think this would do to other parts of research at Pitt and biology and medicine in general?
Yeah, I think in general, once you show this as a proof of example, it's going to attract more attention. Obviously, you have one, in the beginning, some people who are not used to doing this type of research has to see something that happens before they invest in their time. But it'd be a quick turnaround because they're going to already see within a short time frame, because all the tools and techniques is not going to take long to do it once you get over the paperwork. But then within a year, you'll see the turnaround. And then as Vishnu pointed out and others, you see how quickly it can help patients, how quickly it can really push the research forward. What classically might have taken, I don't know, 2 to 3 years, you could do it within 6 months. And then people are going to come and we'll be a hub of this type. Yeah,
that's great. Well, thank you again for this, both the exciting initiative, partnership, and the future of what we hope to accomplish here. Appreciate the three of you joining the panel, and appreciate all of you listening to this group, and I hope we will continue to report on this great progress next year. So, thanks.
Thank you.